Most people that have costochondritis in the chest area have mid-back pain. In fact, if they don't have pain, they have stiffness. And if they don't have stiffness, they just don't notice the pain or stiffness because they're either taking muscle relaxers or painkillers all the time. Hello everyone. So for those of you that suffer from costochondritis, this is a really important video for you to watch. Also, for those of you that suffer from EDS, Ehlers-Danlos Syndrome, important for you to watch as well. We have a case here, Katie. This is a follow-up. We've done other videos on her. You were a case, if I remember correctly, you had costochondritis for 8 years on the left side. So she had severe pain all the way down into the left rib cage. And to complicate things, she has EDS, which is Ehlers-Danlos Syndrome, and there are 13 subcategories of EDS. We're not going to get into that because we could go on for hours on that. But there are some tests for EDS and then some genetic tests. It's usually passed down from relative. Again, we're not going to go too much into EDS, but what is EDS? EDS, depending on what type you have, can affect the joints and the skin. It can make the skin really stretchy and elastic. It can make the joints hyper flexible. So that's where we get into the chiropractic here and the costochondritis. Because her joints are more flexible, that makes her more susceptible to joint pain and hypermobility of joints and displacement of joints, which is what happened with her ribs. And she suffered from really severe pain, panic attacks.
Yep.
Yeah, so now, so we treated her back in...
August through September, October?
Yep, August of last year. And she's done great. Costochondritis, pretty much a done deal. What was the key for her, not just the stretches and exercises, but the chiropractic, but really the one thing that really kind of helped you get over that edge was the cold laser therapy.
Oh my God, yes.
Yeah.
Yeah.
So we were able to, we were using one frequency on her, and as soon as we changed the frequency and went deeper with a deeper tissue laser, that's when things really started to change very quickly for her. I just wanted to touch base on Ehlers-Danlos and costochondritis. A lot of you probably have seen some of our videos on that and have done some of the different 22 exercises and stretches, and sometimes it irritates or aggravates the pain. Keep it up, keep doing them, but you may need a little bit more. You may need chiropractic, or in her case, cold laser therapy on top of that. There are a lot of places around the country that do cold laser therapy. We're in New York. We rent cold lasers as well now, which is something new. I don't think we had that when you were...
I think you just started.
We just started, okay. So you can take one home for a week or two, especially if you live in the tri-state New York area. That's an option, but let's go into why you're back. It's been 6 months. You went to the Sunshine State, or
yes.
no? California?
California.
Okay.
Close enough.
All right.
Yes, I went across the country and didn't have any care, and was like a lot more active than everything. So I came back because I have a little bit, of symptoms, but it's by no means as severe or as painful, and as debilitating as before.
Okay, where are some of the pain symptoms that you're having right now?
A little bit like over here on the left,
okay.
And sometimes in my upper sternum, which pops a little bit.
Okay.
And then I also have some issues, or just trouble with my
lower
hips.
Back?
Yeah, I also have
which
a chair.
She never really had. You said you were hiking in California.
Yeah, I've gotten more active as I've built up my tolerance.
Okay. So stand up.
Yep.
Okay, so she said her clavicle was popping, so we're just gonna check that. And that looks to be balanced. Okay, lay on your back for me.
Back.
So I know that she has a really tight pec muscle. So
Definitely looser than before.
yeah, and have you been doing your
Yes.
pec stretches? Good. Does this hurt?
A little bit. Yes, but not like before.
Okay. Not like 6 months ago or
Not
a year
like
ago.
I'm like having tears in my eyes.
Yeah, I suggest you guys check that video out, the first one we did on her. She was one of the more severe cases. I think 8 years you had it.
8 years, yeah.
We had one other case where the guy just couldn't get any sleep.
Yeah, oh,
Panic attacks. You were having some of that too, but
yeah. I like felt like my breath was restricted all the time. It like hurt to breathe.
And the traditional medical approach, they don't really have an approach, to be honest with you. Okay, now I want to check your thoracic spine and the ribs. So let's have you turn over on your stomach. So there's a lot of different treatments for costochondritis, but the main one is stretches and exercises and chiropractic care for the thoracic spine. A lot of people I see on social media that have costochondritis, they keep asking, well, why do I have mid-back pain? Your ribs, which attach to your chest here, your chest, your breastbone, your sternum, however you want to word it, wrap around and attach to your mid-back, your spine. So there's a direct relationship. The two work hand in hand. So most people that have costochondritis in the chest area have mid-back pain. In fact, if they don't have pain, they have stiffness. And if they don't have stiffness, they just don't notice the pain or stiffness because they're either taking muscle relaxers or painkillers all the time. But they are directly related. Never, ever, ever, ever have I seen a case of costochondritis without tight muscles here and thoracic spinal misalignments or subluxations in the thoracic spine and or ribs. And sure enough, I'm feeling her back, and I can definitely feel a couple of misalignments right here. And this is right where she was having the pain, right underneath the armpit. You could feel it under the armpit when I press down there. Yeah, so we're just gonna loosen up the muscles here. She knows what to do at home. She's got a bunch of stretches that she's been working on, but she hasn't seen me in about 6 months. So it's common, you know, sometimes you need to pop in for a realignment and check up, and that's what she's doing. A tune-up, so to speak, right? It's funny, most of us take better care of our cars than we take care of our bodies, right? We hear a little cling or a clang, we take our car right into the mechanic to have that fixed. But when you do that with our body, we just take a pill to cover up the symptom. Think about that for a sec. Feel that in the side?
Yeah.
So right here are the rib heads that we're going to be adjusting, which are going to affect obviously the side and even the front, because again, those ribs attach to the sternum, the breastbone, wrap around through the armpit underneath and then to the spine back here. All 10 ribs attached to the spine. The last 2 ribs, the floating ribs, don't. They attach to the spine, and then on the other end they just float out here on the side of our abdomen area. Okay, so since she was complaining of some lower back pain, I found that her right hip is pulled down and back, and we're going to correct that. This is called Thompson Technique. Okay, bend your knees, take a deep breath in, and blow all the way out, and drop your legs down. Good. And again, deep breath in, bend the knees. Good, and blow all the way out. Any numbness or tingling down into the arms, hands, or pinky finger?
Not right now.
Good.
One last thing. Tell me what you think in comments below. I went to film school before I got my doctorate. I do all the writing, directing, producing, sound, editing, and the cool special effects you see here. Folks, I'm not asking for an Academy Award or an Oscar, just a simple thumbs up if you like my video. And don't forget to subscribe to my channel for the latest, greatest content on YouTube. Thank you, appreciate all of you.
The reason I asked her that is the nerve up here, the base of the neck, top of the shoulders, controls sensation into the pinky finger, and it controls your tricep muscle. And I sense that that was subluxated and out of position, so that can create numbness or tingling in your pinky finger, or sometimes people get like twitching in their tricep muscle.
Oh, I have gotten that before.
You have gotten that before?
Yeah, I didn't know that.
There you go. Okay, so that means it's a pinched nerve, most likely at T1 there.
Yeah.
Okay, yep, give yourself a big hug, take a deep breath in, tuck your chin, and blow all the way out. Okay. Good, we just adjusted the rib there. Okay. Hands up in the air. Now, I will say she has a really mild case of Ehlers-Danlos Syndrome. So, I have some cases that are a little more severe where they're really double jointed all over the place. The elbows, the shoulders, everywhere. She's double jointed, but not as much, you know, as some of the other cases. So she has a really mild version of Ehlers-Danlos, thankfully. Relax here. Okay, now, if go ahead and sit up for me. So overall, how would you say the costochondritis is from a year ago?
Oh my god, like a million times better.
Okay, great. Now, if you have any flare-ups or issues, you know, obviously continue with the stretches that we gave you. And if you absolutely need to and come back for another round of laser therapy, we can do that. I don't think we need to do that today.
Yeah, I feel like I'm right now.
But yeah, and you know, maybe check with me in about a month or two.
Yeah.
Okay.
Okay.
All right. Thanks for doing this video for everybody.
Yeah, welcome.
All right. Thanks for tuning in, folks.